Thank you for joining us for the overview of Navicent Health's Family Medicine Fellowship Programs. I'm Dr. Monique Davis-Smith, Program Director for the Family Medicine Program at Navicent Health. We offer 2 fellowship programs. A geriatrics program provides a 1-year fellowship under the supervision of board-certified geriatricians, family medicine, and internal medicine physicians. The Hospice Palliative Care program provides a 1-year fellowship under the supervision of our faculty in a variety of settings, including acute care, home visits, and inpatient hospice. During this video, you'll hear from our fellowship directors and from recent fellows participating in the program here at Navicent Health. I'd first like to introduce you to Dr. Patel, Director of our Geriatric Fellowship.
Thanks, Dr. Davis-Smith. Hi, I'm Dr. Dipesh Patel, Director of Geriatric Medicine Fellowship Program. Our goal is to train geriatric medicine fellows in the delivery of quality care to a diverse population of elderly patients. Our geriatric fellowship is an evidence-based medicine program with a strong emphasis in long-term care and palliative medicine. You will have ample time to read deeply from the geriatric medical literature, as well as to provide comprehensive geriatric assessment in a variety of care settings, including acute care, medical office, long-term care, and home visits. We are proud of our outstanding faculty and our fantastic facilities. We became the first and only comprehensive inpatient care service in the state of Georgia. You will learn the science and art of geriatric medicine here. I encourage you to come and learn for yourself how to provide medical care for older adults, from young, old seniors to the oldest members of our elderly community. The fellowship program is open to all graduates of U.S. or Canadian family medicine and internal medicine residency program, whether you are a new graduate or a seasoned in practice. All applications are handled through the electronic residency application service, ERAS. We are looking for 2 wonderful candidates for each academic year. We strongly prefer to start all fellows on 1st of July of each calendar year. If you are interested, please feel free to contact us with any questions. We look forward to receiving your application and meeting you during the interview. Now let me send you to Dr. Dozier, who will tell you more about our hospice and palliative medicine fellowship.
Thanks, Dipesh. Hello, and thank you for your interest in our program. I'm Dr. Gene Dozier, and I'm the director of the Hospice and Palliative Medicine Fellowship at Navicent Health. Sponsored by the Family Medicine Residency, our HPM Fellowship program is based at 2 primary sites, the Medical Center at Navicent Health and Pine Point Hospice, a beautiful, freestanding inpatient hospice facility that opened in 2010, also part of Navicent Health. The HPM Fellowship is multidisciplinary, involving a wide range of specialties reflecting the diversity of the field and sponsoring boards. Our faculty is committed to the training of HPM professionals with growth opportunities for professional development through a robust, evidence-based medicine educational curriculum, as well as comprehensive clinical experiences. We treat our fellows as junior colleagues, giving them increasing responsibility as they gain experience and maturity. They are fully integrated into the clinical services and provide, under the direction of our faculty, comprehensive palliative care in a variety of settings, including the hospital, home visits, and inpatient hospice. Whether you are a new graduate or seasoned in practice, we welcome your application to our program and look forward to meeting you.
Why should you consider a fellowship in geriatrics in HPM? Let me introduce you to 2 physicians, Dr. Sudicum and Dr. Miller, who will describe what attracted them to our program.
There's a personal sense of gratitude that I have when I'm able to impact the patient's life, and not just them, but their families as well. It doesn't have to be only an inpatient thing or a surgical thing, for example, where most people say, hey, this was a life-changing moment for me. This is just picking up the phone and actually applying everything that I've learned, especially in this fellowship, and personalizing that care plan that the patient needed. My name is Mohammed Jendi. I'm a current fellow at the Geriatrics Fellowship Program at the Medical Center at Navicent Health. Geriatrics is in and of itself a very underserved population, often forgot about. We tend to just put them aside at times and forget that their medicine needs a little bit more tweaking. The beauty of doing the fellowship program here is it's a community-based program. So we have a lot of one-on-one time with the patients and with our faculty, and we also have the support of some of the bigger institutions up in Atlanta as well. The teaching opportunities at this Geriatrics Fellowship program have enriched me personally by being able to become a better listener, even to be able to provide a more personalized approach and treatment plan for my geriatric patients. It's fine-tuned everything that I've learned in my residency. This just takes it a step further and I get more enriched in the detail itself. A word of advice I'd give to the next generation of physicians who are considering a geriatrics fellowship, or even students: you don't know what you're missing until you do it. It's a very flexible program. We take into account your personal life. We take into account that you also have things to do, but we also prioritize your education so that when you graduate, you know exactly what you're doing and you'll be good at it.
When I came on my interview day, I was very impressed by the hospice. Pine Point Hospice was funded and really grew out of a volunteer effort in Macon. And many of the staff members came from all over medicine, from the ICU and different areas, and wanted to contribute to end-of-life care in a hospice setting that was home-like and comfortable for patients and families. So when I saw that in action and I saw the staff there and the volunteers, I was very much drawn to this particular program. I'm Dr. Veronica Sudacon. I recently completed a fellowship in hospice and palliative care here at Navicent. I'll be staying on working in the rehabilitation hospital affiliated with Navicent, and I'll also be providing service in the hospice and palliative care unit here at the main hospital. The faculty here has been so supportive, and that came through on my interview day. We meet people at the hardest times of their lives for themselves or for their family members, so seeing a counselor in action or watching someone provide spiritual support, you just don't learn it from a textbook, and I think having that exposure and those hard conversations just really helps. I would say that here you really do have a safe space to develop. Everyone recognizes the need is so great, and we need more clinicians doing this kind of work. You feel every day a sense of purpose, and no 2 days are ever the same.
Thank you for watching this brief introduction to Navicent Health's Family Medicine Fellowships in Geriatrics and Hospice and Palliative Medicine. We hope you'll consider applying. Our fellowship programs will provide you with a strong foundation and a rewarding career.